identifying the eggs, okay, the character of the eggs from nematodes, cestodes, and also this part is trematodes. First we'll start with the nematodes. So in the nematodes, these are the classic examples. One is Capillaria, which is not much important, but very important one is Enterobius, and also we have Trichuris, very important one. We have Ascaris. In the Ascaris or roundworm, we have two things. The fertile egg of Ascaris is different from the infertile egg. So maybe in the exam, they might give a clinical presentation of Ascaris infection, and they might give you the egg spotter, and in the options to confuse you, they might put up both the fertile Ascaris egg and also an infertile Ascaris egg. So we will see how to differentiate them. And this is very important. We have hookworm, which is both Necator americanus. Okay, what are the two things which we see in hookworm? In hookworm, we have Ankylostoma duodenale and Necator americanus. And next thing is Trichostrongylus species, not much important, but anyway we are going into the details of this topic because we all know topics are repeated, not questions. Okay, this is a high yield topic, and rare questions are frequently asked from the regular topics. Okay, so always they'll ask rare question from a common topic. So we'll look into the details of these eggs. First, let me start with, and skipping this Capillaria because this is the least important, but I think at least you will identify this Capillara philippinis. See, so this is the characteristic finding. Next thing is Enterobius vermicularis. So the size of the egg may not be important, but 55 microns into 26 microns. How to identify this egg? This egg is colorless. See, if you compare with all the eggs shown in this slide and also the next slide, this looks least colorful, right? So this is a colorless egg. One thing which helps you in identifying it. And one more important feature which helps you in recognizing Enterobius vermicularis is it is elongated, but it is asymmetrical. What I say is it is asymmetrical with one side flattened. Okay, one side is flat and other side is convex. Can I say this is a plano-convex egg? So in the exam, if you notice a colorless plano-convex egg, then it is Enterobius vermicularis, right? So this is done. So what is the next thing which you need to look at? The next one is Trichuris trichura. So next one is Trichuris trichura, and it has the characteristic shape, that is, as you can see, it is barrel shaped elongated egg. What is the character of Trichuris trichura? Please repeat. It is a barrel shaped egg with a polar plug, which is yellowish brown polar plug. So barrel shaped egg with a polar plug is characteristic of Trichuris trichura. Very important one. These polar plugs are distinctive feature of this Trichuris trichura. Next thing which we will be looking at is hookworm. We'll finish off hookworm, then we'll come back to the ankylostoma, the ascaris part. So next is hookworm. Hookworm, both the eggs you cannot differentiate them. Okay, both ankylostoma and Necator americanus, they both have the same feature. Like the egg looks similar. Try to find out the characteristic feature of this hookworm. It is not elongated. This is oval or elliptical. So this is either ellipsoid or oval egg, and it has a thin shell. As you can see, these are thick shells, both the stuff. But the shell of hookworm is thin, but it is also, it's not easy for you to differentiate it. One more characteristic thing is it is colorless. Like Entropius, as you can see, the whitish nature, this is also colorless. What differentiate Entropius from the hookworm egg? Entropius, yes, it is colorless, but it is plano-convex and elongated. Whereas this hookworm one is oval or elliptical. And let me come to the most important character. The eggs are, when they are passed into the feces, they are in advanced stage of development. Okay, so these are embryonated eggs. Okay, sometimes. So you can see either a 4-cell stage or a 8-cell stage, or sometimes even 16 or more cells. You can see this embryo is almost developing. So these embryonated eggs are a characteristic feature. Okay, this 4 to 8 or 16 celled stage is characteristic of hookworm. Okay, so if someone asks you, like kind of, I have come across a question wherein they have given a presentation in a child of anemia, because hookworm infection is an intestinal infection leading to anemia, and in the feces they have shown this egg, and in the options they have given first option as ankylostoma duodenale, and second option as necator, and third option as hookworm. Fourth is, like, let's say roundworm or ascaris, which is it is ruled out, right? So now we are confused with these three options. So what is the concept here? If you are examining a stool sample, if you are looking at a hookworm egg, what is it? Hookworm egg, it is oval or elliptical and colorless with an embryonated form, or 4 to 8 or 16 cell stage. You can only report it as hookworm because the species identification is not possible by just looking at the egg of a hookworm. So this is your take home. What is your take home? When you see a hookworm, just write it as a egg of hookworm. You cannot just mention either as ankylo or necator because the species identification is not possible by just looking at the egg. That's it. So these are the three important eggs which are frequently asked in the exam. So you might be worried like how to go ahead and finish up these eggs. But I had seen only these questions from these three stuff. Very rarely they have went into cestodes and also trematodes. But mainly Entropius, Trichuris and also hookworm questions are asked. The next concept which I want to discuss with you is how to differentiate this fertile ascaris egg from an infertile ascaris egg. One thing is, in infertile ascaris egg, you can see it is elongate. Just by looking at the egg, you can say it is elongated. Whereas the fertile ascaris is a bit round, like what I say hookworm, it's round. But both these are differentiated from hookworm with the help of a thick shell. So the shell is very thick here. This is thick shell. And also these are colorful, not colorless. So though ascaris and hookworm you might confuse, the color helps you in differentiating these two. Okay, the color helps you in differentiating these two. And these are in infertile egg. Okay, it's elongated, either triangular or kidney shaped. Sometimes it can even have bezier. Okay, the shell is very thin, you can see. Shell is very thin, and very importantly, the internal material which is there is a mass of irregular globules and granules. See, the granular material and globular irregular material is a characteristic finding seen in infertile ascaris, whereas a single cell, that is one cell which is separated from all the sides, see, the cell is separated from the shell from all the ends throughout the circle. So this is how you differentiate a fertile egg from an infertile. Sometimes it might be 2 cell, 4 or more cells can also be there, but mostly you will see single cell stage of ascaris. So I only want to cover these 1, 2, 3 and also 4 organisms from this, because this Tricho, Strongylis and Capillaria, they're not that important exam point of view. Okay, so I'm just jumping into the next part, that is we'll look into the cestodes now. So what are these cestodes? Cestodes are flat forms, and the classic example is Taenia solium and Taenia saginata. These are smaller size eggs in comparison. Just look at the slides. Look at the whole slide from nematodes and cestodes. Let me also take you to the trematode part. So in trematode you have small stool sample eggs, that is Clonorchis and Ophistonorchis, which are not important, not asked in the exam. But in the exam, if they want to ask you a kind of smallest egg, okay, the smallest egg in the stool sample is from cestodes, that is Taenia. It is almost in the 30 to 35 microns in size. And what is the size you see here? The size is, okay, the shape here is spherical. We'll go very slow, okay? And the color is very important. Have you seen this walnut? Okay, this egg almost looks like a walnut color, that is walnut brown, very similar to a walnut. And at what stage this egg is passed in the feces, because you will be looking at that. One thing is clear, it has a thick, very thick striated shell, thick striated shell, normal thick shell, normal thick shell, thick shell, but thin shell, thin shell. But here thick striated shell, the special feature is added here. So we're going very slow. We are done with 4 eggs. We're coming back to the 5th egg. And how to identify it? I am giving you the characteristic features of a Taenia. It looks walnut brown. It is spherical. Whatever we have seen so far, it looks more spherical in comparison with thick striated shell in a walnut brown color. And when it is passed, it is an embryonated egg, and you will see 6 hooks inside it, which are not clearly seen, but you will see 3 pairs of hooks or 6 hooks inside the egg, and we call it as an oncosphere. We call it as an oncosphere. And one thing is, same concept what we applied for hookworm is also applied here. If you are a microbiologist, you are looking at a stool sample. If you want to give a report saying that it's Taenia, you cannot differentiate by just looking at the egg whether it is Taenia saginata or Taenia solium, because the species identification is not possible by looking at the eggs. Then how to identify a species in case of Taenia? If I ask you that question, how to identify a species whether it is Taenia saginata or Taenia solium, for that you need to look at the proglottids. Okay, the proglottids are the scoliosis. So which is not a part of discussion in this video. Okay, we'll be doing that separately when we discuss parasitology in detail. But here the proglottids and scoliosis will help you in differentiating Taenia saginata from Taenia solium, but not eggs. So you have to only report it as Taenia species, similar to the hookworm. This is your take-home concept. So I think this much is kind of more than enough for you when it comes to identification of the eggs. Beyond this, not very questions are asked, but I'm continuing this topic so that we'll cover everything with regards to what we call the eggs in parasitology topic. The next one is Hymenopsis nana. It's a kind of smaller one again. Okay, and it is not spherical. Look at the shape, it is oval. Okay, the characteristic feature here is it is a 2-membrane shell. We have a shell, right? We have thick shells, we have thin shells, we have a striated shell, and now we have a 2-membrane shell. That is how you differentiate Hymenolopsis nana. Okay, and one more thing is, in the inner shell, inner membrane, as you can see, we have small knobs or small poles. Okay, inner membrane contains knobs or what we call poles, from which a 4 to 8 filaments arise, 4 to 8 filaments arise and spread out between the two membranes. So to make you understand the same concept, see, whatever I just described, the two membranes, knob, pole, filaments arising from it is not clearly seen here. Let me draw a diagram and explain it to you. I'm drawing it in a bigger size. Yes, it's an oval one. We have two membranes in the shell. It is outer and this one is inner. And as said, it has two small knobs on the inner shell like this. Okay, two small knobs or poles, and from this 4 to 8 filaments, okay, they arise and they spread between the two membranes, and it is colorless again. So what are the colorless cell ones which we have seen? This is colorless, hookworm is colorless, and this Hymenolopsis nana is colorless again. And inside we have 6 hooks or 3 pairs of hooks similar to the tinea. So the characteristic feature here is the polar filaments which we see, which helps you in differentiating the Hymenolopsis nana. And this Hymenolopsis nana and Hymenolopsis diminuta are the two different species which can be differentiated by looking at the egg. Okay, they might ask a question. They will give you species identification is possible with hookworm, tinea, Hymenolopsis, all of the above. You can choose Hymenolopsis because Hymenolopsis nana and diminuta can be differentiated first by looking at the color. First is size difference is there. This is colorful. Okay, this is colorful. And you see outer membrane is striated. Okay. And we have a thin inner membrane with slight poles. Okay. And the space is not even all throughout. Okay. It is to the side. Inner membrane is slightly to the side and it is granular and it is X. It also has 6 hooked oncosphere inside the shell. So the poles are rudimentary. So whatever poles which I have just told you, these poles are rudimentary when it comes to the Hymenolopsis diminuta. So we're left with 2 more eggs here which are important again but not high yield. We have Diphyllobothrium latum and Dipylidium caninum. So Dipylidium caninum, let me finish off. This might have a color, but CDC has mentioned that it is colorless again. Okay, so this one is colorless. Dipylidium caninum is colorless, and we have 6 hooks inside it. And but very importantly, this is not a single egg. We have 5 or more eggs, that is almost 5 to 15 eggs are enclosed in a single sac or a capsule. Okay, this is the characteristic feature of Dipylidium caninum, that is eggs are contained in a sac or a capsule, and when these capsules are ruptured, eggs are released freely into the surrounding. And next what we have, the last one from cestodes is Diphyllobothrium latum. This Diphyllobothrium latum is again oval, as you can see from the size. It is colorful because yellow to brown color you can see. The characteristic feature of this egg which you need to remember and important for exam point of view is it's an operculated egg. Operculum is a lid. You can see a lid like structure here. It's an oval or elliptical with an inconspicuous operculum at one end. Okay, it might have a small knob at the other end, but this is operculated egg. And you might confuse this egg with the hookworm egg in the exam. Okay, please, this operculum or lid structure which help you in differentiating this, and also the color. Hookworm is colorless, Diphyllobothrium latum is colorful. This is confusing, just look at this. And you might also confuse it with Ascariasis because both are colorful. Okay, but you can see this single cell is getting separated from the surrounding here, and there's no operculum again. So that's the reason I'm telling you Diphyllobothrium latum can be differentiated from this close species of Ascaris and hookworm with the help of operculum which is present. So hope you are following this session, though it is lengthy, but this is very important. Now you have characteristic findings. Before entering into the trematodes, let's do a small exercise, okay, so that you will not forget whatever is taught so far. Let's start with colorless plano-convex egg, that is Enterobius. Colorless plano-convex egg. And next thing is, species differentiation is not possible with both hookworm and Taenia species, but it is possible with Hymenoplepsis. And eggs are passed in groups, okay, that is Dipedilium caninum. Next, operculated egg is seen in Diphyllobothrium latum, okay, and polar plugs between the two membranes with the filaments is a characteristic feature of Hymenoplepsis nana. Okay, so these are the few things that you need to remember from this topic. And what is the characteristic feature of Trichuris? Barrel-shaped egg. Barrel-shaped egg is characteristic of Trichuris trichura. Let's quickly jump into the trematode discussion. So in the trematode, we have so many eggs here, but in the exam, they're focusing more on differentiating this Schistosomiasis species. That is differentiation between Hematobium japonicum, okay, and Mansoni. These are the three things they're asking in the exam. So we'll only look into these three important aspects, okay. So I'm only covering these three important aspects from this, whatever which we discuss, okay. So we'll start with the Schistosoma Mansoni. This one. But please look at this. Can you see operculum here? Can you see an operculum here? Can you see an operculum or lid-like structure here? What are the operculated eggs? Paragonimus westermanni, Opistharchus, Clonarchus, and what was that cestode egg which is operculated? What was it? It is Diphyllobothrium latum. So let me very briskly give you the list of operculated eggs so that you can remember. So the operculated eggs are the four things which we just mentioned. That is very importantly the Paragonimus westermanni. Just write it down because you will remember it. It's easy to. Next is Opistharchus. I don't have a mnemonic for this. Next is Clonarchus. And as we discussed, fourth one Diphyllobothrium latum. And Fasciola. Okay, Fasciola species also has this operculated eggs. Please remember these things. Next thing. So after looking at this, what we call operculated one, the last thing which we will cover in this is differentiating this Schistosoma Mansoni from Hematobium and Japonicum. Try to look at these three eggs. Okay. The one thing which is differentiating these three is a kind of spine. Can I say spine? This looks like a spine, right? Till now we were discussing pole or knob or filament and hooks in the Taenia. So these are the four things which are helping you in differentiating, and also shell, which is covering it, thick and thin shell, and also operculum. Okay, see, look at the confusing terminology. But not all these which are essential to differentiate schistosoma species. What is important is the spine, very important one. So they might ask you a question. Schistosoma species are differentiated with the help of presence of pole or knob or filament or hook or shell or operculum. No, not all this. It is spine which helps in differentiating Mansoni, Japonicum and Hematobium. So what is this Mansoni? Mansoni is an elongated head, very big one. See, it's almost 140 microns with a prominent lateral spine. Okay, which is lateral spine. See this hematobium. Hematobium, it has terminal spine. Look at this Japonicum. It also has a spine. I'll call it as rudimentary spine. You can clearly differentiate it. See, this spine is rudimentary, that is vestigial. You cannot make it. Instead of spine, it has become a knob. Small lateral spine is seen in Japonicum, which is rudimentary. So instead of calling it as a spine, you can call it as a hook or lob or a depression. So all these eggs are yellow or brown. But what differentiates Mansoni, Japonicum, Hematobium is the presence of the spine. So this done. So these are the stool stuff which you need to understand. The eggs in the stool are eggs in parasitology, are stool species examination, or stool species identification. So I tried to cover all the high yield points here. And before finishing off, let me read the question and finish off these questions also. A patient is having GI symptoms like abdominal pain, anorexia, bloody or mucoid diarrhea, tenesmus with rectal prolapse, very important one. Examination of stool is showing the following finding. What is the causative agent? See this barrel-shaped egg with plugs at the end. Barrel-shaped egg with plugs at the end. What is this? It is Trichuris trichura. Very easy, because all other are not even in the scene. Okay, so I think this makes it easy for you. Barrel shaped egg, and options are also given pretty easily here. And because we are discussing this question, let me give you a few more points about this what we call Trichuris trichuria. Okay, and this bipolar protuberance is because of mucus plugs. It is a barrel shaped egg again. Okay, what is the other name for Trichuris trichura? I am writing down few important points about this organism. It is also known as whipworm. It is an intestinal worm. And what is the infective form? Infective form is the same. It is embryonated egg. Embryonated egg is the infective form. And next one. How a patient with Trichuris trichura presents? Please remember this key point, rectal prolapse. See, rectal prolapse is seen with what we call intermittent or chronic diarrhea leading to the loss of fat and all. But somehow I have seen so many questions mentioning this keyword rectal prolapse, which is specific to this Trichuris infection. Okay, so rectal prolapse is a hallmark symptom of heavy Trichuris trichura infection that occurs in children more frequently than adults. Whenever rectal prolapse occurs, the worm can be identified on the rectum, which is edematous, which is lying outside. So in whipworm infection, the rectum loses its internal support because the worms bury their thin heads into the intestinal lining, which loosens the elastic epithelium and weakening the surrounding muscles. So I think with whatever description I just gave you, it is evident that the Trichuris trichura characteristic feature is rectal prolapse. So this is the answer for this question. So next question, as you can see, is the same one. A child aged 8 years presented with perianal pruritus, which is worse in the night. And this Scotch tape method demonstrates X as shown in the given image. Identify the organism which is causing the infection. There are two steps here. First, you have to identify the diagnosis, perianal pruritus, Scotch tape method is used for. Next thing is identify the egg seen in the stool. This is a plano-convex egg. What is this? It is a plano-convex colorless egg. So plano-convex colorless egg is Enterobius vermicularis. See, knowing Enterobius vermicularis is also not sufficient for this question. You also need to know in this part, this is otherwise known as pinworm. Okay, so what are the diagnostic clues in the question? First thing is elongated, asymmetrical, one side, that is plano-convex egg, colorless, and it is not bile stained, and it is thick with double layered transparent eggshell, and we are using Scotch tape method. Why do we use Scotch tape method? These pinworms, when you see, the characteristic of this pinworm is they are not released directly in the feces. So just by looking at a fecal ova or parasite test, you cannot identify it, because they, with their pinhead, they stick around the anal cavity. They stick there. So for that, you have to use a special method called Scotch tape method to release them. Okay. So the infection is mostly seen in children and also common in females than in males. And the characteristic of this pinworm infection is it produces intense irritation and pruritus. Okay. And because of this, there will be scratching and excoriation of the skin around the anus. And these worms, they comes out, okay, at the night times, and they cause disturbance in the sleep. So the answer here is pinworm. So we're done with the two questions, and whatever I promised, like the differentiation part, classification, everything is finished in this single video.